All right, all right. Always something at the last second there. All right, we are live. My computer tipped over there while I had a guest in the virtual green room and ready to go. Sorry about that scare. It was not an earthquake. We did have a power outage in the middle of one of our episodes, and just screen froze up. Both of our mouths were open. My wife was on. Tammy was on with me, co-hosting. The power shut off, and then we figured out what was going on. We came back. We were able to jump right back in. I don't know, 6 or 7 minutes later. Welcome. Co-Video Live TV episode number 31. Today, I always have to check. Today's April 21st, Tuesday, April 21st. Welcome to episode 31. We got a little bit of a late start. Let me take a look around and make sure everything's cool. We did have the one episode where we didn't hit the start button. I don't have anybody working with me. That always tends to be the problem. I did not hit the start button and we didn't start on time. All right, we've got good audio. We've got a guest queued up. We've got a second guest in the virtual green room. I guess without any further ado, let's just start things off right now. Let's bring in our first guest. Let's give a nice Co-Video Live TV welcome to Dr. Lynn Carr. Lynn, are you there?
I'm here.
All right, good. And I can hear you perfectly well. How are things been going for you?
Pretty good, pretty good. Enjoying a lot of family time right now.
Yeah, exactly. Well, when you're not enjoying that extra family time, you're busy working. Tell everybody a little bit about what you do, for work. Introduced you as Dr. Lynn Carr. Please elaborate.
Well, yes, my name is Dr. Lynn Carr. I'm a pediatric dentist. I practice in the two locations in Dyer, Indiana and Crown Point, serving all of Northwest Indiana, specializing in children, so dentistry for children.
Mm-hmm.
I grew up in the area and I came back to this area to practice a career that I love, and built a small practice in the area. I'm treating a lot of family, friends, and expanding it over time. So it's been really good. And a lot of things have changed, obviously, for everyone. So
Definitely. I was near your office just yesterday. I picked up some dinner for Mitch and for me over at Pops, and you're not too far away, right? On Dyer on Route 30.
Not too far, just down a couple, just down the street.
All right, they're not sponsors of ours, but you're right next to Geno's as well, right? Maybe you and I could get a gift card out of that mention, maybe.
Good places. I frequent for lunchtime. Yep.
All right. So we were talking a little bit. I wanted to know from your perspective in dentistry, pediatric dentistry, how the whole COVID-19 and governor's lockdowns and orders have affected you. So how has it been for you for the past now, 5 weeks? Are we in our fifth or sixth week now?
Yeah, it's starting to blend together, right? So it's been a while. Let's see. So Governor Holcomb, when he declared the first executive order, dental offices were closed to only see emergencies and urgent care.
Mm-hmm.
So we have been open just for those procedures only, which is pretty much trauma and infections or abscesses. So we went from probably seeing about 40 patients a day with routine, preventative, elective, and restorative or surgical to about 3 a week. And my whole team has been furloughed. And I see about, I have 2 employees that are helping a little bit with phone and all of those things. So I think the biggest thing is, just kind of keeping people positive at home, but not knowing when the date would be until recently.
Yeah. Some people don't realize the size or the impact when an operation or a practice as yours is idle. There are plenty of dentists operating by themselves with one person extra maybe, but you've got a significant staff who's not working as well, right?
Yes, we do. I mean, we're not a huge practice. We're probably somewhere in the middle, but we're seeing a large pediatric population base. And so we are under the recommendation or guidelines from the American Dental Association as well as the Indiana Dental Association, which takes their guidelines pretty much. They've been following Governor Holcomb, who's been making the statements as of yet as to what to do.
Mm-hmm. You did say, though, that you're able to see emergencies, of course, right? I mean, if something happens, the usual things trouble that kids get into.
Some of that, yes, trauma. We've had a lot of kids roughhousing. We saw a lot at the beginning of this. I think there was a lot of frustration and lost energy and kids working it out and, kids banging into each other and heads hitting grounds and things. We've had some broken teeth. So a little bit of that, and then some untreated care that would come back with infection. Unfortunately, I've seen probably way too many abscesses in these last 6 weeks. I'm
Mhm.
related to those types of things, just patients that are having pain and suddenly they can't get in anywhere. So there's been a little bit of panic there. Um, but yeah, pretty much just those things. And then hygiene recall, anything elective, preventative, even restorative fillings, crowns, just anything that needs to be addressed, that's been on hold.
Right. All that been on hold for a significant amount of time. But as we were talking earlier, you are in dentistry, modern dentistry, fairly clean to begin with. I don't know the exact clinical terms, but well, anytime I've been to my dentist, they're all dressed up like they're heading to doing some major surgery on me, right?
So I can speak for my colleagues and offices across the board. Universal precautions are always followed. So head to toe, like you said, it's everything's disinfected. And I was mentioning earlier, we're cleaner than any rest. I don't want to, we actually wipe down with Kevi wipes and all these, hospital grade medical wipes. So we're doing that between every single patient and all the time, regardless. Um, whether if you go to a library or a bathroom or a restaurant or anywhere, they're not using medical wipes between every little thing. No one really does. They don't have to. They're not required to, but we are required to.
Hmm.
That's just our standard of care for our profession. So because we're working in that type of environment. So yep. So it's really clean. A lot of the questions, come up with other things. The mouth. And then the latest thing that's come up has been the aerosols. And so a lot of people want to know about that. So a lot of that is combated with our high evacuation system. So it's called HVE. And so that's how we move the aerosols through. They don't go through the air like a lot of people think if they're sucked up with a high evacuation system.
Aerosols, not air fresheners or sprays or perfumes or clothes. You're talking about what's coming out of people's lungs.
With dentistry, yes. So that would be with a handpiece. Yep.
Hey, I know hair stylists and barbers are all on lockdown as well, and people are trying to cut hair on their own. Do you recommend people try and clean their teeth or do home dentistry at all?
No.
No.
I say brush at home, floss at home. That's been our motto. Try to take care of things. I hope these kiddos are having good diets at home. I know it's a tough time and a lot of things have gone out the window because the days are running together a little bit for these not having systems or calendars in place. But no, I don't recommend that at all. No home dentistry.
All right, good. I was hoping you wouldn't. I didn't want to get you or me or myself in trouble. So, so are you? You're not without knowing when things are starting. You can't even like begin to reschedule at all, right?
That's a great point. And our patient base and families have been wonderful because we have done countless phone calls, not knowing really where to put them when we're calling them. So at one point we thought it was a couple weeks we'd be down and we were scheduling just a few weeks out because parents wanted to get in. As the weeks went on, we were moving people a little further out into the summer and some just want to wait because they don't know what's going on.
Right.
And that's obviously normal because, no one knows.
Have you? I wouldn't think that it would lend itself to it, but have you been able to do any telemedicine, teledentistry, video, anything like what this looks
Yeah.
like, or have you done that at all?
We have all that in play. So we're open on Tuesday mornings. I have it on my website at actually at cardds.com. There's a nice little pop-up when you go on my website that says what we're only seeing urgent care and emergencies, but it's also directing patients to do teledentistry on Tuesday if they would have a question, or if they want to show me something via the video. It's a great tool, similar to something like this. They sit in a virtual waiting room. It's not virtual.
Right, the virtual green room we have here too.
Yeah, it's mostly, I kind of started mostly, obviously you can't do dentistry online. I actually need an x-ray and, I see patients and things for prescriptions. But if somebody I know well, or if it's just somebody I don't know well and they just want to run it by me, or they want to ask me something really quick that saves them a trip or even a little bit of worry, I find we're a pretty big presence in the community that I feel it's nice to have someone that they can go when everything's shut down. We've had patients calling from other offices that just all their offices are down or out or closed completely, and they're just like, can you take me? Can you check this out? Or, other offices have called us to get some patients in. So that's been helpful. But so this is just teledentistry. It's through Doxy.me. So it's a service that we've been using. And it's linked. You can see it on my website. We actually have it on Facebook site as well. Just if parents want to reach out and ask me some things or show me something or.
Mm-hmm.
That's been nice.
So with less office hour, no office hours except for that, you've got a lot of time to be at home. So you're probably lending a hand with all of the e-learning and telehomework that's going on in your house. You still have two daughters who are in school, right?
Yes, yes, I have one that's pretty independent in high school doing her thing, and then I have a fourth grader as Mike's.
Right. And
Yeah,
so
I'm doing a little bit
is
of
it
that. A
is
lot.
it challenging your fourth grade math skills, or how you doing?
No, not too bad. Not too bad. Everything's been going pretty smoothly. The fourth grader does what the high schooler does, so she wants to do what she does, and we have them set up in a nice little living room setup. They're doing all those good things. I'm trying to do some webinars for mom. I'm learning about all kinds of the new rules and new loans out there and all the things that they're doing to try to help us, small businesses. As I mentioned, our dentists, we have a good size staff and a good size, debt and loans from school, as well as these equipment that we need to do to provide the dentistry that we do. So our overhead's pretty high. It's just like a lot of businesses. So
Mhm.
they're reaching out to provide this SBA, and I understand that they just approved another one, so that's great.
Yeah, I don't know at what level that's in, what process 3.5 is in, but yeah, additional payroll protection plan, right? Right.
Yeah.
I hope so. Hey, we're getting near the end of our halfway mark here. Is there anybody that you want to say hello to or anything you want to get out there?
See, I just want to thank all the parents and families that have reached out. We've had a lot of phone calls just saying hi to us and reaching out just to say hi and asking us when we're opening. And a lot of parents just want us to be open and just don't even understand why we're closed. So I appreciate their patience and glad they're staying home and washing hands and keeping their loved ones healthy and safe at home. Always been trying to stay positive, trying to say, hey, I hope this ends soon. Looks like it's coming around. There was a little bit of hope that was talked about with Governor Holcomb for possible Monday of April 27th. So it might be like a soft open, I call it.
Right.
I mean, we might be seeing very limited patients and slowly getting back into it, limited staff, possibly having patients wait in the car, and different things, possible temperature checks before they come in. Just little things for the first few weeks. Patients might see a difference, but I want to thank all my patients and my team because my team has been unbelievable. So Danielle, Jessica, Angela, Caitlin, Andrea, Sabrina, Nancy, Dr. Clark. Love them all, and I want to thank them all, and I hope I didn't miss anybody. And Angela, I think I said Angela too. So all of my staff has been wonderful. They're my team. So at LMK Pediatric Dental Care.
Got it. All right. I appreciate you coming on, Lynn, Dr. Lynn. And hopefully we will be seeing you back in person around the school sometime, hopefully in August, at least.
Yeah, you want to go back? The kids want to see their friends. We can't wait.
No kidding. All right. Thanks for joining us, Lynn. I appreciate you coming on. If this drags on further, can we check back in with you sometime possibly?
Absolutely.
All right. Appreciate it. We're going to get on to our next guest. Thanks for joining us, Lynn.
Thank you.
I'm going to turn off the audio there, go to the logo. We'll be right back. Hang in there. Okay, and just like that, we are back. I'm going to get my audio back up. We got our second guest queued up in the Co-Video Live TV green room, virtual green room. Couple people in the chat there. Lee Smolin, Lee's in the house, and Suzanne. I didn't mention Suzanne from Nashville, and Lee checking in from Carmel, Indiana. All right, without further ado, let's just move right on to our second guest of the night, a good friend of mine. Let's give a nice Co-Video Live TV welcome to Mr. Tim Dauphin. Hello, Tim.
Hey, Ron, how you doing? Thanks for having me on.
Yeah, we talked a little bit, and then we went our separate ways. You fired up the grill and made some dinner. Everything turned out all right?
Oh, it's great. Made some brats, Italian sausage, baked beans, potatoes. You can't go wrong.
What's your where's your go-to brat from? You pick it up. Where do you get those?
Strax.
Gotcha. Gotcha. Hey, do you cook them put them in the beer before you grill them or after?
I put the beer in me while I'm eating them.
Okay, all right, that's a good approach. That covers up all the different angles. All right, Tim. I wanted to bring you on first of all because you're an entertaining man. I always enjoy being out. Usually it's at the bar at Cherville Lounge. Unfortunately, we can't have a virtual drink here. We have to get back there sooner or later. But I wanted to talk to you a little bit about what you've been doing. Can you tell everybody what you do in your day job?
I work for Allen's Landscape Center, Cherville.
Right.
Designed for them and manage the retail store for the most part.
Mm-hmm.
Do all the purchasing and everything else that needs to be done around there to keep the lights on, basically.
Yeah, so I was curious how things were going. I thought that your business would be crazy because people would be having landscaping services done while they were sitting at home looking at their yards or their and deciding what they want to do and having you guys come out and do it. It sounds like people are doing a lot of DIY, right?
Yeah, they are, Ron. It's going both ways. You're still getting a lot of calls for design work and for us to install. But we're always a good month out for doing that. So right now people are calling and having us deliver a lot of mulch and stone and dirt, and they're doing it themselves. They're going a little stir crazy at home and looking for something to do.
Just what we need. The emergency rooms are trying to deal with COVID, and they're going to be getting hernias and back injuries, and right.
Let's hope not, but you may be right.
Well, I don't know. What's your preference? Is it rock or mulch? What's your go-to?
I prefer the mulch look. It's a little more maintenance, a little more work, but I think it looks more natural.
All right. So what would your be, we didn't talk about this earlier, but it just hit me. What would your advice be for somebody who's trying to keep the weeds out of it and wants a minimal maintenance? What would they do? Chemical approach? Just blast it with Roundup?
That depends on what you've got planted in there. That Roundup will kill anything it touches. So if you want low maintenance, definitely go the stone route then. And just keep up on the weeding, once a week. While before you mow the lawn, go out there and pull a few weeds you see, throw them out in the yard and suck them up with the lawnmower.
Here's a novel idea. Or get your kids out there to do it, possibly. Is that crazy? Am I talking crazy?
That's a little tough. Yeah, I know I can't get mine to do it. Maybe you can. If you got it, no.
Anything over 80 degrees is too hot, so I'm not sure. It usually ends up being Tammy and I who end up doing that kind of work. Something else of interest you were saying that I didn't understand this, but I'm getting a clear picture. You've got a lot of work to do typically in the months of March and April, and you've got to be busy to get what done?
Yeah, we're swamped right now. March, April in a typical year, that's when we are gearing up and setting up the garden center and bringing in all of our nursery stock, our live trees and plants, shrubs, everything. And we've only got a small window in the spring to do that. Once the frost leaves the ground, you want to get everything dug at the nursery, balled and burlapped, put in pots, whatever they're going to do, and get them to a garden center such as us before they bud out in the spring. So we have to be going hard right now, even though the economy is uncertain. We don't know what's going to happen this year. Hopefully we can sell our product. But we have to put it out there and get it out there just to have a season right now.
So if you don't put something in the ground in these months while it's budding, then it has a much lower chance of surviving beyond whatever at all, right?
Well, not so much putting it in the ground as is digging it from the farm and getting it to us. Mm-hmm. The growers need to dig it before they bud out. And then we have it on the ground at the garden center on drips. throughout the season until someone's ready to plant it. You can plant throughout the season, no problem. Things will survive the same, but you've got to get them dug before they bud out in the spring.
Are you
Before-
seeing any difficulties in acquiring anything in these times? I don't know, with either logistically or I don't know. Are there certain things in higher demand right now?
Not really because of this. I mean, we're still seeing shortages because of the crash in 07 and 08.
Oh.
A lot of nurseries couldn't sell their product for a year or two and got too big, and they would mow it down and have to start fresh. So there's a shortage on a lot of trees, but not because of COVID-19. That's just affecting us more on foot traffic at the garden center. Not a lot of people coming in to buy.
Mhm.
We're doing a lot of deliveries to people, but it's over the phone. A lot of contactless delivering. Pay with a credit card, dump and drive, and leave. But we're busy with that.
Yeah, which was surprising to me that you weren't getting that you didn't have as much traffic in. I don't know if the weather hasn't been good enough yet where people are out shopping for flowers to pot and plant around their house.
That's playing into it as well, definitely. The cold weather, I mean, we've had 10, 15 degree fluctuations in the weather from day to day. Definitely when the sun shines, the phone rings, and we do get some more people in. But a lot of people are still scared. They're not coming out. They're staying with the stay-at-home rule and abiding by it.
Mm-hmm. Hey, do you see inquiries, or are you stocking up or expecting to sell any more of consumables like tomatoes? I'm talking about stuff that's legal in Indiana to grow. Tomatoes, cucumbers, the basic home produce, herbs that people may be more aware of and not wanting to get out and shop for.
Definitely. We sell the plants, tomato plants, herbs, peppers, all the vegetable type plants, and annuals. And in the next few weeks, we'll be starting to get that in once the weather warms up a little bit more.
Mhm.
So yeah, we'll have a full array of whatever people want to put in their garden. Definitely.
Are you expecting an uptick in that?
We're hoping so. We're actually getting a lot of people calling and putting in raised gardens in their backyard right now. So they need dirt delivered and planting mix delivered. So we're hoping that translates into them coming back to buy the plants from us as well.
Right. Yeah, exactly. Right. They may just, hopefully they get it built and they don't have a pile of dirt sitting in their driveway in September too, right?
Some of them may.
That might be me, because Tammy was already talking about doing a garden in the back, and I think as people are together, it'd be something fun to do with kids. But again, like kind of like pulling weeds, it'd probably end up being the parents maintaining it, right?
Most definitely, Ron. Yes, definitely.
There are a ton of deer around here. If you're growing stuff in your backyard in this area, and I back up against wetlands here, do you just completely enclose it with chicken wire to keep all sorts of critters that would want to eat it out?
Yeah, the chicken wire will work for the rabbits and the small ones, but the deer, you gotta get something a little taller. 6-foot fence of some kind, or they make products you can put on the plants to repel them.
Mhm.
But if the deer's hungry enough, they'll eat.
Yeah, that's what I thought. That's what I thought. And I don't have a shotgun. Actually, I don't think my neighbors would like me firing that at deer around here, but it wouldn't be something I would do. So you said that there are any particular flowers you think are going to be hot this year? What's your go-to flower, potted flower? What do you got at the Dolphin House usually?
The Dolphin House is like the shoemaker's son. My landscape isn't nearly done at all. I do a little bit each year. It's been a 20-year process, and I'm still not to where I'm planting flowers every year.
All right, the barber's kids have the worst haircuts.
Exactly. I work 10, 11 hours a day, 6 days a week during the planting season. So my house is the last one to get done.
Are you I wonder if you're going to be are you pretty well staffed up to do all the jobs that you've got coming?
That's always a struggle, trying to find good help. The garden center, we're pretty good, but our landscape crews that can actually go out and do the work, always looking for good help, good work. And it's difficult. And it's difficult right now, especially with the unemployment benefits that are out there that they're getting. They're making more money not working right now than working. It's a struggle.
I did hear that. I just thought it might open up with record unemployment. I thought maybe it would open up a whole larger pool of people who would be interested in trying something. Now, I know it is harder work, but when you got to work, you got to work, right?
That's true, and it is hard work. I mean, it's you earn your paycheck, and so far we haven't had much luck finding a whole lot of people out there.
So I know that hairstylists will be probably doing a lot of corrective work, bad colors, bad cuts, and such. So you think a lot of these home landscaping jobs are going to be calling you back for come and make this right or finish this for us? We got in too deep.
That's a definite possibility. We see that anyways when people try to do it themselves and get in over their head sometimes and realize how much work it is, and the wife gets tired of looking at the pile of rock for 4 months and calls a landscaper.
Sounds familiar. It really sounds familiar. I'm starting to get nervous. All right. How about outside of work when you are home? You said you're the one who ends up doing all the shopping on your way home because you're already out. Is that the gig there? Since you're out, can you stop by the store, right?
Basically, yeah. Shannon and the girls stay at home, trying to do the whole stay at home thing like they tell us to do. And I'm out anyways, so I might as well go face the crowds, stand in line to get in the store and get what we need.
So you're gone all day, so you're successfully avoiding any of the trials of tribulations of e-learning, home learning, right? Remote learning?
Thank goodness, yes. These teachers are doing a great job, though. St. Mike's, I commend them. They're working hard, even though we're not in school, and we appreciate everything they do.
Right. Agreed. Tammy teaches kindergarten, and she had a Zoom class with her class, and wow, I don't think you can run lower grade level classes via the internet. It was a sight to see. It was a sight. Hey, we're getting down to 8:30. Tim, is there anybody you wanted to say hello to, or anybody? Any final thoughts?
Yeah, shout out to my wife, of course, my kids, Shannon and Grace and Ella, and family at St. Mike's. Miss y'all. And your buddy, Joe Hofferth. Didn't know we had a mutual friend.
Where did you meet Joe?
I've known Joe for years. He used to work at Allen's years ago.
That is right. That is right.
He wised up and went on to bigger and better things.
All right. Well, I was communicating with him earlier. Unfortunately, another mutual friend of Joe's and mine is not doing well. So I will be talking to him again, unrelated to COVID, but not a very sad circumstance there. But I don't want to end on that note. It was good to have you on, Tim. I appreciate it. Maybe we can check back in with you as things go on if we want to or if we need to.
Yeah, anytime, Ron. I enjoyed being on, and I'm glad you had me.
All right. Well, it took a while to get you on. It felt like I was twisting your arm, but it was good to get you on. Good to see you, even if it's remotely. As soon as we can, we need to get out and hoist a couple and talk about our time surviving the COVID-19 lockdown of 2020, right?
Can't wait, Ron. Can't wait.
All right. I'm going to get you out of here right now. Thanks for joining us, Tim.
Thank you.
All right. Tim Dauphin, thanks for joining us. All right. And with that, we're going to be moving on. This has been episode number 31, CoVideo Live TV, episode 31. Tune in tomorrow for episode number 32. We've got some things lined up for the next 3 days. We're mostly booked for the next 3. So we're really looking forward to that. Until then, everybody, be safe, take care, and we'll see you tomorrow.